The job description of a patient care assistant, PCA, centers around providing basic healthcare support and personal assistance to patients under the supervision of nurses and medical professionals. Patient care assistants, often known as PCAs or healthcare aides, play a crucial role in the day-to-day well-being of patients in hospitals, clinics, nursing homes, and residential care facilities. Their responsibilities focus on enhancing the comfort, dignity, and safety of those they care for, particularly patients who are elderly, disabled, or recovering from illness or surgery. Patient care assistants are often the closest to the patients in terms of continuous direct contact. They help with everyday activities such as bathing, grooming, feeding, repositioning, and mobility assistance. In many cases, PCAs also monitor vital signs, report changes in patients' conditions, and support emotional well-being through compassion and attentiveness. Their contribution ensures that patients receive the kind of personalized care that supports recovery and improves quality of life. Though not always licensed medical professionals, PCAs must be highly skilled in caregiving, communication, and observation. They serve as a bridge between patients and the nursing team, often detecting early signs of health deterioration. Their presence enables registered nurses and physicians to manage clinical tasks more efficiently, while knowing that patients' immediate needs are being met with diligence and empathy. Core responsibilities of a patient care assistant. At the heart of the PCA's role is assistance with activities of daily living, ADLs. This includes helping patients bathe, dress, brush their teeth, and use the bathroom. For patients with limited mobility, PCAs help them move between beds and wheelchairs, prevent bed sores through repositioning, and ensure that they are comfortable and safe. Hygiene and physical care not only improve health outcomes, but also preserve the dignity of patients, especially those dependent on others for personal needs. Feeding support is another essential responsibility. PCAs assist patients during meals, especially those who have difficulty chewing, swallowing, or using utensils. In some facilities, patient care assistants are also tasked with monitoring fluid intake and dietary restrictions, especially for patients with diabetes, high blood pressure, or other medical conditions that require nutritional management. Ensuring proper nourishment and hydration is vital to the patient's overall health. Monitoring and recording vital signs, such as temperature, pulse, respiration, and blood pressure, is another common duty. While PCAs do not diagnose conditions, they often identify early warning signs of medical issues, such as labored breathing, high fever, or unusual swelling. These observations are reported promptly to nurses or doctors for further action. This responsibility requires accuracy, attentiveness, and familiarity with basic medical equipment like thermometers and blood pressure cuffs. Another major aspect of the role involves providing emotional support to patients. Many individuals under PCA care feel vulnerable, isolated, or anxious, particularly during long hospital stays or when recovering from serious conditions. Patient care assistants offer companionship, conversation, and reassurance. A friendly presence can ease patient stress and significantly enhance the healing environment. PCAs are also expected to maintain cleanliness in the patient's environment. This includes changing bed linens, cleaning up spills, organizing medical supplies, and ensuring that patient rooms are free of hazards. In some settings, they assist in infection control procedures by wearing personal protective equipment, PPE, disposing of contaminated items safely, and disinfecting surfaces regularly. In specialized care environments, such as dementia units, rehabilitation centers, or pediatric wards, patient care assistants may have additional training to respond to specific patient needs. They might assist with therapeutic exercises, support cognitive engagement, or ensure patient safety when dealing with memory-related disorders or behavioral challenges. Midway through this detailed breakdown of duties, it becomes evident that the job description of a patient care assistant is both demanding and profoundly impactful. It encompasses not just physical tasks, but also emotional intelligence, strong observation skills, and a constant presence that brings stability and care to a patient's everyday life. Essential skills and qualities for the role. Compassion is arguably the most important trait for a patient care assistant. The ability to care deeply for others and treat patients with kindness and patience is vital. PCAs often serve individuals who are at their most vulnerable, dealing with pain, fear, or loss of independence. So sensitivity and respect are non-negotiable. Communication skills are also central to the job. PCAs must be able to listen carefully to patients' needs and express themselves clearly to nurses and doctors. Accurate reporting ensures continuity of care, especially in facilities with multiple shifts and rotating staff. Written documentation, such as care logs or daily charts, must be thorough and precise. Physical stamina is essential, as the job can be physically demanding. Patient care assistants spend long hours on their feet, assist with lifting or moving patients, and respond quickly to emergencies. Therefore, good health, strength, and energy are key to sustaining high performance throughout a shift. Attention to detail is another crucial skill. A small error, such as missing a dose of food for a diabetic patient or overlooking a skin irritation, can have serious consequences. PCAs must remain observant at all times, no matter how routine the tasks may seem. Time management and organization are also important, especially in high-volume care environments. PCAs must juggle multiple responsibilities, respond to changing patient needs, and prioritize their duties effectively. Being punctual and dependable ensures that the care process runs smoothly and that patients are not neglected. Confidentiality and professionalism are expected in all interactions. Patient care assistants must respect the privacy of health information and maintain discretion at all times. Trustworthiness is critical, as PCAs often assist with intimate and sensitive aspects of patient life. Work environment and career outlook. Patient care assistants work in a variety of healthcare settings, including hospitals, long-term care facilities, rehabilitation centers, and private homes. The environment can be fast-paced and emotionally intense, especially in acute care units or during end-of-life care. Shifts often include nights, weekends, and holidays, reflecting the 24/7 nature of healthcare services. Despite the challenges, many find the work deeply fulfilling. PCAs build meaningful relationships with patients and families, witness recovery and healing, and contribute directly to others' well-being. Their role is recognized as an essential support system in modern healthcare. Career advancement is also possible. Many patient care assistants choose to continue their education and become licensed practical nurses, LPNs, registered nurses, RNs, or certified nursing assistants, CNAs. Some institutions offer tuition reimbursement or internal training programs to support such transitions. With experience, PCAs may also move into supervisory roles or specialize in specific areas of care, such as geriatrics or pediatrics. To become a PCA, candidates typically need a high school diploma or equivalent, followed by a short-term training program, often offered by community colleges or vocational schools. Some employers require certification in basic life support, BLS, or cardiopulmonary resuscitation, CPR. On-the-job training is common, especially for new hires unfamiliar with patient lifting techniques, infection control, or medical documentation protocols. By the time one has explored all aspects of this career, it becomes even more apparent that the job description of a patient care assistant isn't simply about routine tasks. It's about making patients feel seen, valued, and safe through the quality of daily interactions and supportive care. Conclusion. The job description of a patient care assistant reflects a vital and multifaceted role in the healthcare system. These professionals contribute directly to the healing process by offering physical assistance, emotional support, and observational insights that help guide treatment plans. They form the backbone of patient-centered care and are integral in delivering comfort and compassion to those who need it most. For those who possess patience, empathy, and a strong sense of purpose, a career as a patient care assistant offers both meaningful work and valuable experience. It is a role that not only improves the lives of patients, but also inspires a deep sense of professional fulfillment in those who choose to serve.